All right, welcome everybody. We're going to go ahead and get started in the interest of time. I'm sure people will continue to filter in, but thank you so much for being with us for our webinar tonight, which is about promoting healthy relationships between people with severe epilepsy and their siblings. And we're really thrilled tonight to have a number of siblings from a variety of ages and with a variety of experiences to join us to share with you a bit about what their experience has been and what's been great and what's been hard, because we know there's a lot of both in this life. So quickly, I'm Gabi Conacher. I'm the co-founder of Wishes for Elliot and the Deep Connections Project. And this is Elliot, my kiddo with SCN8A related epilepsy and DEE. And this is Vega, his sister, who, and that is Honey Bunny, everybody. Welcome to our life here. Just a couple of quick housekeeping things. This session is being recorded. It will be available online in a few days. If you have any questions throughout, I welcome you going ahead and putting them in the chat box or the Q&A, and we'll be monitoring that. We'll go through the presentation and the chat a little bit, and then we'll move on to questions. So don't think we're forgetting you. We aren't. And just so everybody knows, they are muted, which will stay on that way for the remainder of the webinar, just because of the technical issues. So let's go ahead and get started. Vega, you're the first one we're going to talk to. Vega is 4 years old, and she's Elliot's sister. Do you want to tell us a little bit about what it's like to be Elliot's sister?
Yeah.
Okay.
It's kind of hard, but
yeah,
we play a lot together. We're a good team.
You're a good team.
And luckily, I found a new way to wrestle with him without hurting him.
Yes, we're currently working on being gentle, and so she's found a new way to wrestle with Elliot. She's created a special wrestling way for them. So that's pretty awesome. So what's your favorite thing about being Elliot's sister?
That I get snuggled up over him on my mind, and I'm a really good sister.
You are a very good sister, that's true.
When Mommy and Daddy do something to him, he hates it, and I bring him all toys, especially the Honey Bunny sitting next to me.
That's very true.
So happy, and I snuggle him.
It's great. So Vega is a very good sister. Whenever we're doing something to Elliot, all of you know that you have to do a lot of things to your kids or your siblings or whoever that they hate, but have to be done. And so Vega helps with that. And whenever we're doing something he doesn't like, she brings him a toy. And she says, wait, I gotta get Honey Bunny. So it's true. Yeah. Is there anything else you want to say about having a brother or sister who is not like all the other brothers and sisters out there? What do you think about having a brother like Elliot? No? But you love him and you're a great sister. That's for sure. Oh yeah. Like this. Yep. With the hugging and the kissing and the loving. Okay. Thank you, Vega. Thank you, Elliot. Okay, I think we'll go ahead and move on in the interest of time. We wanted to just share an additional perspective of a wide... Oh, you have something else to say? Oh, well, you guys get a special presentation here of what Vega Elliot wrestling looks like. All right. Oh.
It looks rough, but it's gentle.
This has been refined over many, many months. So thank you, Vega. All right. So moving along, Lily, welcome. We're so happy to have you with us tonight.
Hi.
You wanna tell us a little bit about yourself, about Harper, your sibling, and Seth too, who's also your sibling, a little bit about life and what life's been like for you?
Yes, so my name is Lily and I am 12 and I love gymnastics and art. So my sister Harper, she was born when I was 2 and she was born with CDKL5 deficiency disorder. And it's basically where a gene in her body was broken, so she couldn't walk, she couldn't talk, she couldn't eat my mouth. And it was, when she was born, I didn't really see it as a problem because no baby can really do anything. But as she got older, I noticed, okay, she's not the same as other people, other kids, because I looked at my friend's siblings and realized, they don't act the way she does. So at first, she couldn't, like I said, she couldn't really do anything. And as she got older, she had seizures, and she got older, so I noticed, she's not doing anything. She's just sitting there in a chair, and, she's not active like I am, like my friend's siblings. And then she started having seizures, and I was curious about it. And then when around ages like 3, age 3, she started taking a supplement that helped her be more active. And I was happy because I got to play with her, and I was very, she was more active, and we got to play in a dollhouse. And then around ages 5, my brother came along, and life got a lot more interesting. He was very difficult. He was like, I don't want to say an extra Harper, but it was a kind of like an easier Harper to deal with. But he was very verbal. So he was very, loud and stuff. So life got more chaotic towards when she got older. And then when she passed, we had just moved. So we were trying to, situate ourselves in our lives into like a more, get into our new normal, I guess. So, and Seth was still very young, so it was hard because he didn't understand what it meant, because he was like, hang on, first Harper was here, now she's not, so I'm kind of confused. And it was sad because there was the UPS coming to deliver a package, and he heard the doorbell ring, and he came running to the door saying, Harper, Harper, Harper. And we're like, no, buddy, it's not Harper, it's just a package. She's not gonna come back, she's gone. And he was very confused about that. But now he understands, but he doesn't really remember her. He just remembers her by pictures. So for him, it's different. But for me, I was older. I was 8 when she passed. And the thing that was really sad to me is that it was 2 weeks before my 8th birthday. So I was 7 when she passed, but it was 2 weeks before my birthday. And I did not enjoy that. I was very sad. I was hoping she would be there for my birthday, but she passed before. And I didn't like that I was at my grandparents' house when she passed. I got to say bye to her, but not like other kids would be, like other siblings would be able to say goodbye to their siblings, if they were to go away, pass away, or go somewhere, So I was sad with that. But, it's been 4 years, so we've gotten through it, but it's still kind of, different. So.
Thank you so much, Lily. So I know that you said that Harper was your best friend. Yeah.
Yes.
So
yes.
Can you tell us a little bit about what you would do with Harper? I know Harper was not somebody who could run around and jump and play. So Vega says that Elliot is her best friend too. So I think, it shows just this incredible bond that you are able to create with Harper. And I'm curious if you could talk a little bit about how you did that, what that looked like.
Of course, yes. So we were very close. We were just glue stuck to a piece of paper. So like I said, at first she was like a doll and we couldn't really do anything. So when we would play in the dollhouse, I was frustrated because I was like, I want Harper to play with me. I want her to take her doll, hold it, and, play her role. So I still got to play with her, but it was harder because I was upset that she couldn't grab the doll and play. Oh, and then when we found this supplement, when we found this supplement that helped her, be more active, she was able to grab a hold of things and, say yes or no. And I was like, wow, this is really cool, because she was able to play in the dollhouse. And it was funny because when she took the supplement, she was playing with me. And then when she got older, she wouldn't, so an example is she would not participate in therapy. The therapist would say, okay, I'm going to give this toy to Lily. And she would perk up, take the toy, because she did not want me to have it. She was like, no, you can't have this toy. It's mine, and no one else is touching it. So she would perk up and take it. And I was like, this is funny, because, as she got older, she started to be more verbal and a little bit more, she had an attitude, let's just say that. She was very, she would, do things on purpose to make people mad, but she would laugh because she thought it was funny. So what I like to do with her is I like to swim. I liked to swim. I like to, play in the dollhouse. We got the dollhouse for, I think it was her first or second Christmas, and we loved it. We were there all the time. We played in it all the time. And so I love to play with that with her, and I love to be a part of her therapy sessions. That was really I loved just being a part of that, helping her, getting more into, helping or learning to care for her. That was really what I love to do. I love to get up in the morning and do her oral therapy and watch TV and dress her and, do all that stuff with her. It was a lot of fun. So.
Yeah, that's incredible. I mean, that's a really remarkable way to be able to bond with somebody who lives a very different kind of life than you, right?
Yes.
To be a part of those things. Because frankly, if you aren't a part of those, then it's hard to be very, integrated into their lives. Because I know, especially with kids who are severely impacted, that is a lot of their life is respiratory therapies and physical therapy and occupational therapy and speech therapy and, treatments and meds and all of that. So yeah, and I think that's really remarkable. And I know that you've taken an active role in kind of speaking about this kind of a life. You talk about having led the life before, with Harper, and then after Harper, you talked about how your life is kind of big segmented like that. So yeah, I know that you're carrying on Harper's legacy by, speaking and being, an advocate. Do you want to talk a little bit about the work that you do with Hope4Harper?
So my mom started this nonprofit, Hope4Harper, when I think Harper was 2, to raise money for other special needs children that needed any equipment or special equipment, to help them. And when Harper passed away, we were asked to speak at a lot of conferences. And there was this conference in Dallas I was asked to speak at, and I think I was 8 or 9, and I was extremely nervous. But then after I spoke, I realized wow, I can actually speak in front of people. And it was a small group, 50, I think. So I would speak a little bit about that. And then after that, we got more into deeper into the conferences and the conventions and stuff. So they would ask me and my mom to come speak, and we would go to these conferences, go to these places to speak. And I just spoke a lot about what life was like with Harper, what it was like without her, or what it's like without her, and just a little bit about her. So I don't do as much now, but I still do them. But so that's basically what I do with the Hope4Harper.
Yeah, no, we're so thrilled that you agreed to be with us here today and share your perspective. It's so wonderful to hear, and you are doing a lot by, talking to people about what it's like and what it can be to lose a sibling, I think is incredibly powerful. You know, we talk about that already with Vega, who's 4, because it could happen, right?
Yeah.
So I'm going to throw you one more question that you haven't prepared for possibly, but if you had advice, you know, if there's another sibling who's 12 years old out there of a kid who's got, you know, a lot of health need, you know, a lot of health issues and requires a lot of your parents' time and energy, is there any advice you would give to them?
Are you talking? So you're talking about like them having a sibling with special needs?
Yeah. So if you met a 12-year-old who, you know, had a sibling like Harper,
Yeah.
you know, and they just found out something just happened and their sibling is like them, what would you say to them? What advice would you give them about how to survive, how to
Yeah.
develop a relationship with their sibling?
Yeah. So I would just say, like, really spend a lot of time with them. Like, take a deep breath, calm down. You're gonna have time with them. Just like sit with them. Try to be like involved in their life a lot. Ask your parents, like, hey, can you teach me how to do this with her? Can you teach me how to, you know, feed her or do her therapies or help her out? I would just say, you know, to ask their parents, you know, to help them out and spend a lot of time with her and get really deeply involved into their life so that you can make sure that you get every second that you can with them. So
Thanks. That's lovely. That's wonderful advice. All right. Thank you so much, Lily. That was really wonderful. And I think Aria will chat with you a little bit. And Lily, I'm sure we'll come back to you a little bit later with some more questions. So thanks
yes,
for sticking with us. All right. So Aria, do you want to introduce yourself and tell us a little bit about your experiences and Evan, your sibling, and what life's been like for you all?
Yeah, absolutely. It's going to be a hard story to follow, but I'm happy to talk about my experiences. So my name is Aria Moss. I'm the sister of Evan Moss, who's 2 years younger than me. And he has epilepsy, which comes from a genetic disorder that he has called tuberous sclerosis complex. And tuberous sclerosis complex is a disorder, a genetic disorder, where the person affected, they have a tumor suppressor gene that doesn't work anymore, and that causes tumors to grow in vital organs. So Evan currently has tumors in his liver and kidneys, in addition to brain tumors, which he's had his whole life. And those brain tumors cause his epilepsy. He has had seizures since months after he was born, pretty much his whole life. And because we're so close in age, I'm just 2 years older, I really can't remember a time pre-epilepsy for him. He was diagnosed with tuberous sclerosis when he was 2 years old. And that has kind of really, to a huge extent, kind of dictated the course of our lives. That's both me and my brother, I think. And my parents, too. My parents tell stories about how when I was little and we would play on the playground together, Evan would feel a seizure coming on and he would sit down on the playground and I would run over and start counting out loud, 1 Mississippi, 2 Mississippi, so that we could keep track of how long his seizure lasted, even when we were at school, so there weren't grown-ups around or whatever. And so I've really been very involved with Evan my whole life, and with tuberous sclerosis and epilepsy as a whole. When he was 4 years old, his seizures had gotten really bad, and he was on so much medication that it was really affecting like his personality. He was less vibrant than he was before, so we looked at brain surgery as an option, and he had a 3-stage resection surgery, meaning they took out those tumors, and then he was seizure-free for 2 years, which was really amazing. But before his brain surgery, my parents had been trying to track his seizures, and they had been given a single sheet of paper with 365 boxes on it, one for every day of the year, and were told to note down all of those seizures. And that didn't work very well for a kid who was having not dozens, but several seizures a day. So Dad actually made an online tool to help track his seizures, later dubbed Seizure Tracker. And when he showed it to the doctor said, "You gotta make this public." And he actually launched Seizure Tracker for public use from the waiting room of the hospital as Evan went into his first brain surgery, which is a story that sounds like it's coming right out of a book. Like, I couldn't write that if I wanted to, but it's really, really kind of a cool story. His seizures came back 2 years later. Before then, he was having several simple partial seizures a day. Since then, he's had seizures every 2 weeks or more. We're actually seeing that kind of cycle elongate some recently, which is very, very cool. And then those seizures are all nocturnal, meaning they only happen when he's asleep, which we love, and last closer to like 8 minutes in length, which means that they are status seizures, having lasted more than 5 minutes. So every couple weeks, Evan goes into a status seizure. He's doing really well. He is typically developed to issue labels of what's the word I'm looking for? Whatever. But he's doing really well. He's in school at typically developed. He's old enough to be in 11th grade now because school is ending. And so he's in 11th grade and he's at normal classes, which is really awesome. Throughout his life, our family has been really, really invested in his health. Beyond just my dad developing Seizure Tracker, my mom works for the Tuberous Sclerosis Alliance, which is dedicated to helping those affected, both patients and their families who have TSC. And I think it's definitely shaped all of our lives. Mom and Dad went to photo school and they were photographers for a time. And then Dad turned to web developing and Mom turned to fundraising. And that's really had a major impact on our lives. I personally have done a lot with that too. We've been to so many fundraisers, so many walks. And we have, I've done a lot to try and support Evan beyond just like hospital visits and being there for him. I think it's really dictated my interests. I wanted to be a doctor for years, to no one's surprise. And recently I've done a project using Seizure Tracker data to try and forecast seizures. We lean away from the term predict, but that would be the ultimate goal, to try and help people better determine when seizures are happening. And I've been working on that with a partner for a little over a year now. And we've presented, we've been really, really fortunate to be able to present at the Tuberous Sclerosis Alliance's International Research Conference, as well as the American Epilepsy Society's December conference, which has been really, really amazing. It's kind of crazy having this part in my life. I can't imagine what might be different about our lives if Evan didn't have TSC or epilepsy. It's impacted all of us so much that that is entirely impossible to understand or think about. Evan and I are really close. I think there's a sentiment going around about your sibling being your best friend, and I definitely know that we are very, very close. He will rant to me about Pokemon or Dungeons and Dragons all the time, and I will pretend like I'm not listening and then get really invested in it, in whatever he's talking about. But yeah, it's kind of a crazy experience, but we are, we're staying strong and making the best of it each step of the way.
Yeah, no, that's fantastic. And I think, we're lucky to have some people on who do have their siblings as their best friends, but I know of many where it's a lot more of a struggle. And I think, I'm curious if you can tell us how you think it ended up that you guys became best friends instead of you resenting the attention, that Evan was getting, or, feeling like, he was the preferred child because, he needed that attention. Do you think it was something your parents did, or do you think that it was how you chose to kind of view things? What do you think happened there?
It's hard to say. I mean, I think Evan and I have talked about this some, like, we feel like we're a lot nicer to each other than some of our friends and their siblings are. And part of that is because I think mom's an only child and won't stand for anything even approaching bickering between us. Hard to have any conflict when mom stamps it out right away. But I mean, on a more serious note, like, it's, Evan has had yearly MRIs for his whole life. My freshman year and his 7th grade year, so his first year of middle school, he spent like 3 weeks in the hospital because he was diagnosed with diabetes and had a huge sugar spike in his blood sugar, which triggered a seizure, which left him bedridden for a while. And like, when you have these experiences that are so, it puts everything in perspective. Like, it's hard to really, for there to be much tension between us when I see him in the hospital bed all the time. I will say, like, I have personally never felt like he was necessarily a preferred child. I think part of it is my parents. I think they're really good at, like, when Evan went to the hospital and he got a popsicle, I got a popsicle too. Or ice cream. Ice cream makes everything better. That's a saying in our household. And I'm sure that
advice is that just give your kids ice cream. That's the
yeah every day. It's like a medication in and of itself. It's really important.
Yeah.
But I don't necessarily know why I never felt like that. I've heard people talking about how they've felt like their sibling was kind of preferred and that was something that they struggled with. But honestly, that was never something that I've really felt myself. And I think, like, Evan is so cool and he struggles a lot. Like, he's gone through so much more than I can even imagine or comprehend. And I personally, I don't really feel it. And I don't know exactly why my experience might be different than others. But
yeah, I think the reality is that it's probably a lot of factors that come together to make it to what it is for every sibling. So I'll pose the same question to you. Is there any piece of advice that you would give to siblings? I guess I could open it up to any stage of life, really. You've been through many stages together. Is there one piece of advice you give to a sibling about, what to do, what to not do?
Yeah. It's a good question, and you asked it to Lily, and I knew you were going to ask it to me, and I still don't have anything really, deep and profound to share.
Okay.
I don't think there's a single piece of advice that I think would have profoundly changed my life or did profoundly change my life. But I will say, like, one of the things that's been most helpful to me through, like, the difficult parts was keeping myself aware of the situation and educated. And this is partially advice for siblings and partially advice for parents, I think. Like, my parents were really good at keeping me in the loop. And that's really made a difference for me in the like medical emergency style things, where I was told what was going on, and I kept researching things on my own. I researched tuberous sclerosis complex and epilepsy itself, and I know a lot about those now. I also think one of the things that's been very nice is that I've always been given the option and always chosen to stay with Evan. Like, when he has a hospital trip because his seizure runs abnormally long, then, you know, I have missed mornings at school because we transported to the ER, and my parents went, "Do you want to stay home? You can stay home and you can sleep and you can go to school." And I went, "Why would I stay home and sleep when my brother's in the hospital?" And being there has alleviated a lot of anxiety for me, just kind of across the board. And having that option and taking that option, even when it kind of brings everything else to a standstill, has been really beneficial for me my whole life as well.
That's interesting. Yeah, that kind of transparency and having full access, not being restricted or left out. Yeah, I think that's really interesting. Thank you so much, Aria. It's really exciting to hear about kind of the path you're going down and that you're choosing. And it's really helpful to hear about your experiences. So thank you so much. We'll come back to you with some more questions, I'm sure. But next, we're going to bring on Dr. Laura Lubbers. And she is amazing. And I will let her introduce herself, although she probably won't give herself as many accolades as she deserves. So.
Well, thank you so much, Gabi. And it's so great to be here with Aria and Lily to talk about sibling relationships. Ellyn is my sister, and she's there in that beautiful blue coat and her beautiful blue eyes. She is my older sister, and like Aria's brother, Evan, Ellyn has tuberous sclerosis. She's 3 years older than me, so like Aria, I also don't remember a time when there weren't seizures in our life. She started having seizures at around 3 or 4 months of age, and this was back in the 60s when we really didn't know anything, and there weren't really good medications. So seizures were a very regular part of our life, as were the awful side effects of the medications and all the medication changes. And we have that super long list of all the anticonvulsants that everybody has, and the vagal nerve stimulator, and trying everything that we could do to help her. I have to admit that I was one of those, I wouldn't say resentful siblings, but in reflection, I have to say, I was an angry sibling. I had a lot of responsibility like everybody else. By age 10, I was distributing medications. I knew how to manage seizures just like everybody else. We're really good at it. We're really good at jumping in and helping out. And I did it with as much eagerness as I possibly could, but I wasn't happy about it. I knew it needed to be done. She needed to be cared for, but again, I wasn't happy about it. And I could see all the things that our family was missing out on. You know, having regular family vacations, things that you could kind of count on, weren't there. And back in that time, we really didn't talk about epilepsy as a society or disabilities. We were still very isolated as a family. I didn't know anybody else who experienced what we experienced. And so that probably also contributed to my feelings. But I really loved the brain. I really loved studying the brain. It was fascinating how we work. And so I went off and did research and got a degree in neuroscience, but I still hated epilepsy. And I still hated tuberous sclerosis. And because there wasn't a lot of hope for change. And somewhere in there, I grew up I remember the moment. I was standing in front of an Aria, you'll appreciate this. I was standing in front of a neuroscience poster, looking at the neurons and realizing just how different it was in a TSC brain, and how could I hold on to that anger that I had. She couldn't help it. She didn't know. And she was sweet and kind. And it was me who really had to reflect. And so I decided to use my powers for good and change my perspective, and got involved in the TS Alliance as a start. And then joined the organization that I work for, which is called Cure Epilepsy, because we need to cure epilepsy. And all of that negative emotion that I had has been flipped around to try to make a difference, because we need to help. We need to do whatever we can to make a difference. And things have changing because of it. And that's a wonderful thing to see, that, you know, there are groups that are funding research. We're learning more and more about the different pathways that cause epilepsy, and we need to, you know, come up with better solutions for people. So that's a little bit about, you know, how I've come to where I've come. And Ellyn continues to struggle. We need new therapies for her and everybody else. It's a life of challenges, and it's a life of challenges that change over time. As people get older, and things that we didn't foresee when she was 20, we now have to deal with now that she's in her 50s. So as a scientist, I geek out, and I look for understanding. What have people done? And so if it's okay, I'd like to share a couple of studies, research studies, that help actually put some of these things in perspective. It touches on what we've been talking about. So let me pull up this slide. I've got just 2 slides I want to share.
And while you're doing that, Laura, I want to thank you for sharing that perspective. I think it's so important that we recognize that it isn't always, you know, like it has been for some of these other kids, you know, and that's okay. Like, that's the experience that some people have, and, you know, it's exciting and nice that you transitioned to a place where you could see it a little differently. But everybody's got their own path on this, and there's so many factors that play into how people are impacted by this incredibly life-changing stuff. So yeah, thank you for sharing that.
Yeah, it's so true. And it's so interesting as I reflect on it, that the thing that made the difference for me, the thing that made me finally get it, was something that I had resonated with, which was the science and the data, and seeing that. So it's finding that thing that touches you, and all of a sudden, wow, there's a change. So anyway, can you see my slides?
Yes, they're up.
So, you know, when I started looking at this, like, well, what's been done on siblings? I mean, how do people understand us? How do we understand us? What's been done? There hasn't been that much research done on us, but I think that's changing because of the voice of the voice of the advocate, whether that's a parent or a sibling or another relative. You know, there's clearly a need to understand how we cope so that we can do it better. So these are just a couple of studies. They're really not very many. And one of them goes back to 2006. And this is a study that interviewed young people. Well, it actually didn't interview young people. What it did was it interviewed the parents of young people. So this is from the parents' perspective. And they asked, well, how do you think your unaffected sibling child is managing? And they came back and they said, well, we think that there's sadness and there's fear. There were some other things that weren't, that didn't rank quite as high, like anxiety was low. But the things that really came out were sadness, fear, and worry. And I think that still resonates. It was interesting that siblings of children who had controlled epilepsy were less worried in general in this study. But one of the one of the flaws in this study is they only asked about the negative emotions. They didn't really have that good balance. So Barbara Kroner and her team did a more recent study and published last year, 2 years ago, where again, she interviewed the parents to say, how do you think your unaffected children are doing with this life surrounded by epilepsy and neurodevelopmental disorders? And what they said is, looking at both the positive and the more challenging, that there was they sensed a greater sense of protectiveness. And I think that comes through in some of the discussions that we've had. But they're still worried about the next seizure. And interestingly, they're concerned about the possibility of their sibling experiencing pain during a seizure. But many were also very proud to have a sibling with epilepsy. I think that's a really neat piece of this. Again, this study found that siblings with children with controlled seizures were less anxious, but actually they were still worried about that next seizure and when that could happen, even though it was controlled. And that parents who had more anxiety were more likely to report anxiety in their own kids. So that was an interesting piece. But both of these studies did say in their concluding remarks that, we really need to hear the voice of the sibling to understand what the sibling is feeling. So that study was done recently, and I'm going to move on to my next slide here. This study was done and is not published yet, but I do have permission to share these information. And I want to give a shout out to Lori Bailey at Zogenix for her vision of seeing the need to do this. This is not her job. But when I asked Lori, why are you spending time and energy to look at this? She said, it just needs to be done. We need to understand how the siblings feel too. We need a full perspective. So that was really a neat thing to hear, because often the siblings have been sort of overlooked. So what they found, and some of you who are on the call may be aware of these data already, because it's actually based on some of the REN data, I think, and includes siblings with Dravet syndrome or Lennox-Gastaut syndrome. And what they did in this study is they divided up the siblings into different age groups with the, I don't know if you can see my cursor or not, but with the younger preteen age group being in the lime green color, and the teenagers being in the deeper green color, and then the two blue bars represent adult siblings, one from that as they look back at their childhood, and then one from how they feel now. And what she found was that, what this study found was that there's a high amount of depressed mood, I guess I would say. So there's an increased amount of unhappiness. People feel down or irritable and grumpy. People reported not enjoying things. And this was more, interestingly, more for the adult siblings as they look back at their life and as they look at their life now than for the younger age groups. And siblings also feel more tired, particularly the adult siblings. Teenagers have boundless energy, so maybe that's helpful in not feeling so tired and affected by this. Interestingly, the adult siblings report that about 1 in 3 are reported under treatment for clinical depression. And that's something we really need to talk about. That's significant. And there are things that we can do about that. But first, we need to know that. Siblings also reported greater expressions of anxiety as reflected by an increased startle to certain stimuli, or more bad dreams, which is shown on the right-hand graph. So, siblings are reporting having nightmares. And these are important things to know. These are important things to talk about, that having these challenges does impact the emotional health and well-being of siblings. What this study did find, interestingly, and it echoes what Aria was saying, is that the thing that helped people was staying in the loop of knowing, okay, you know, what's happening, being informed, being a part of the solution. That helped people. So that's really important. And also, you know, better education and recognition of, you know, this significant impact in a sibling's life. So those are the things I wanted to share about this study. I want to make sure that there's time for questions as well.
Fantastic. Thank you so much, Laura. And I think it is really important to recognize that this is a really understudied area, right? This is an area that we don't know a ton about. And it's, you know, luckily people like Lori at Genetics are seeing the need for this. And I think this hopefully will spur a lot more research that will be done around this. But, you know, clearly that'll take siblings like all of you who are you know, committed and dedicated and willing to share your experiences. So we thank you so much for being here. We're gonna turn now to some Q&A. So I'll start here. So Daniel asks, as siblings, are there times when you feel left out or jealous of your parents' attention? He's really struggling with juggling time between two kids, which I definitely know what that's like. But from the siblings' point of view, maybe you can share with us, Lily, were there times that you felt left out or jealous of your parents' attention going more to Harper?
So yes, I did, because I was really young and I didn't understand, why is Harper getting more time than me? And I didn't realize she needed more medical attention than general attention. And, you know, she did get more overall attention than I did because of the medical needs. But then when I finally, you know, told my parents, like, I am having, like, I feel like Harper gets more attention than me, my parents said, oh, okay. So they helped me learn, they brought me in to learn how to care for Harper and, you know, feed her and, you know, help with her therapies. And that made it a lot easier, you know, because then we got equal, you know, attention. She still got a little more, but, you know, we still got close to equal attention. So.
Thanks. Aria, did you ever struggle with jealousy at all?
I don't really necessarily ever feel jealous of Evan, I think. I don't remember ever really feeling that way. The thing that I would say is, like, my parents and I have a very good relationship. Lily mentioned, you know, I told my parents, like, I'm kind of feeling left out. And I think that's, you know, it's really awesome that you were able to do that. I never felt that way, so I never really brought it up with my parents. Yeah. But there have been several times in which case they've gone, Aria, we know Evan gets a lot of attention. He did physical therapy. He does hospital trips. He is on reduced school schedule, et cetera, et cetera. How, you know, are you feeling jealous at all? How are you feeling about this? And that gave me the opportunity to assuage their fears and say, no, I'm fine. But I also think, like, just the act of, like, them saying, like, how are you feeling? That attention, like, that shows that they're also paying attention to me and caring about me just by the virtue of asking that question. The thing that I would encourage the most is really to talk to the sibling, your kids, because I think we're pretty good at being quiet sometimes. But it feels good to talk about. And I think the most valuable thing to do is really to, you know, bring it up and say, I want to know if you're feeling this way, and I hope that if you are, we can figure out ways to help you feel more included, and so on and so forth.
Yeah, pardon me while I move. Poor Elliot's having a hard time, so I'm letting Dad take care of him right now. But I mean, I think this brings up some really critical points about open communication and the continued engagement of siblings. And honesty and really checking in. I think that's such an important point you make, Aria. So thanks for sharing that. Laura, I don't know if you want to add anything to that.
I would just say that Aria, you're spot on. I think for my family, we didn't talk about it. Nobody asked, how are you doing? I don't think anybody asked that until I was in my 30s. So, and that was, you know, it was clear that my sister needed more attention. I understood that. But it's still, I think it's still good to check in and find those special things that each sibling, each child enjoys, and just make some time for that. That there is that demonstration of, you know, I know you have needs too, or you want to go do this thing, and we've not been able to do all of these other things because of, you know, the situation we're faced with, but it's still important. And so I agree, the transparency, talking, asking, having that open communication is so important, and will get ahead of some of the anger that can be a part of this.
Yeah, no, I think that's so incredibly powerful to keep in mind. And for us, you know, personally, I'll just quickly share that, you know, Elliot is so, he's so medically fragile and complex that it's hard to really even go out of the house with him very often. And so for us, we've also just tried to carve out little pieces of time where we take Vega out for an ice cream, or it's just one-on-one time. And I think even though, you know, there's times we have to rush and be with Elliot, both of us, because there's a crisis, or, you know, if he's in the hospital, you know, one of us is always there, and she basically lives with my parents, which we're very lucky to have nearby. But I think it kind of, yeah, making that time and space to say, like, I'm committed to you right now, it's about you, is something that we've tried to do. We'll see how it pans out. I'll tell you in 10 years how things look. All right, so we've got a question here, Laura, from a sibling who says, I'm a young adult sibling with an older sib who needs constant care. And as I begin to find my place in the world, I want to transition to more of a caretaker for my sibling. Have you made the transition from sib to legal guardian? How and when did you take that step, and how did you approach that discussion with your parents? That's a great question.
That is a great question, and it's very timely actually for me, because we're working on that. So I'm in my 50s, and I've been trying to have this discussion for years, because my parents are getting older, and I've felt urgency to move that forward. So I think having that discussion, saying, you know, I really do care about this, I really want to be involved, demonstrating that through actions, and, you know, being persistent. But it can take time, because parents are used to managing things, and they still, my parents still saw me as some little kid, even though I was an adult. So we finally have decided move forward as a family for a standby guardianship appointment. So the paperwork is in progress, actually. And that's a great option. We didn't know about that option, that my parents can still be the primary guardians, but I can be the standby. So if one of them can't contribute to decision-making, I can just step in without a problem. And that smooths things. I'm not sure that was available back, you know, 30 years ago, but it is now. And that makes life much more seamless, so that when my parents do pass, I'll be able to have been involved and take on that responsibility much more seamlessly than trying to juggle that in and amongst more family crisis.
Yeah, thank you. That was a great question. And that's something we're hopefully going to touch on in a webinar in the coming months, about preparing for those kinds of transitions. So thank you so much for sharing that. We've got a question about how do you usually explain your special needs sibling situation to your friends? Or is it, or was it ever strange to have friends over? I don't know if one of you feels particularly like you want to jump in and take that.
Yes, if you don't mind me jumping in.
Please, Lily.
Yes. So it never really felt strange, because I was really proud to show her off. I was like, oh, hey, come over here, look at her. She's like, look at my sister. She has special needs. She can't walk, talk, but she can still hear you. So why don't you come over here and talk to her? I love doing that. And it just made me feel like, so like I have a sister and I'm proud, you know. It wasn't really strange to have people over, but it was hard to have them over because, you know, if Harper had like a really bad day, we had to say, oh, we can't have you over, or I can't come over to your house because Harper has to be taken to the doctor and I have to come with my parents. So, you know, maybe another time. It was difficult. It limited my friends, and my friends had to be understanding of that. But it was never really awkward to have people over. It was, if like I said, I felt proud, you know, to show her off. So.
Thanks, Lily. Yeah, and I think, you know, from my perspective, sometimes it's, for us, we're really open with our community about what's going on in our lives and who we are and what our situation is. And Vega's still very young, and she has friends who come over, and it's, you know, we have to figure out how to make kids more comfortable around being around people that are not just like everybody that they know, right? And so a lot of it is doing parents doing education with kids and other parents, and about like, you know, this is my kid, he's got, you know, and letting kids know it's okay to ask. I think a lot of parents get really flustered if their kid says, what's wrong with him? Or, you know, why is he lying down? Why doesn't he go to school? You know, those kinds of questions. And I think the more transparency again and honesty we can have in sharing, you know, the different kind of lives that people lead, you know, it's really important. I don't know if anybody else wants to touch on that. We've got another question we can go to as well. Okay. When your sibling was in medical distress or in the hospital, how did you cope with anxiety accompanied with that?
I'll jump in here. So I am fresh out of high school, and I have dealt with this a couple times in my high school career. The first thing I did, and we're going to be beating a dead horse here, I think, but the first thing I did was I told all my teachers that my brother was in the hospital so I could get permission to have my phone on me at all times and check it if I felt a text. Because a lot of the anxiety I felt was with not understanding or knowing what was happening, or being afraid that I would miss something if something big happened. When my brother was in the hospital freshman year, like I used to think like, what if my parents need to pick me up from school because something happens? And I was really afraid of missing that. So one of the most important things for me was putting myself in a position where I could stay updated. That also involved like leaving school early once, because it was lunchtime and I found myself pacing and anxious the whole time, trying to decide if I would stay at school or go home. And I was like, I am way too anxious for this. I need to be able to be with Evan. So my parents have always given me the option to stay with my brother in a medical emergency, and being able to be there made everything so much better. And when I couldn't be there, when I had to go to school, making sure that I was able to know what was happening and be keyed into that really alleviated a lot of that anxiety for me. It turned it into something I was constantly stressing about to something that was, you know, always in the back of your head there, but not as much a source of stress as it used to be. So that's what I personally found most valuable.
Mm-hmm. Anyone else want to touch on that? That'll be our last question, I think, for the night. We're just about at time here, so.
Oh, I did want to say something. Oh, I'm sorry. Go ahead.
No, please go ahead. Go ahead, Lily.
Okay, thank you. When it's kind of like Aria, when Harper was in the hospital, I couldn't really like be with her, and I was at my grandparents', I was kind of like, well, is Harper okay? And when I was really little, I kind of was like, oh, it's grandparents, I get to, you know, play. But then as I got older, I was like, I don't want to be here. I want to be with her. So we would call my parents like a lot, like hey, is Harper okay? How's everything doing? We FaceTimed them for a long time, to be able to talk to Harper. But kind of like Aria was saying, if I was with her, it made it a lot better. And I did get to go up to the hospital a lot to sit with Harper and be with her. And one of the funny things about that was that I felt like it was a hotel to me, because I would order, the meals and stuff, and it was just really funny because I got to sit in the bed with Harper and watch TV with her, and I was like, this is really cool. I don't know why Harper doesn't like this, but I like Aria said, it made me feel a lot better if I was with her.
Agree with everything you guys said.
Thank you. Yeah, no, I think it's so amazing to have you all sharing kind of your varying experiences. And I think there's a lot of overlap. And I think that things that are universal that siblings go through when you have, when your sibling has, severe epilepsy and seizures and all the other issues that come along with that. This is the life where things don't always go as planned, right? And there are interruptions and Christmases and Hanukkahs and Kwanzas and whatever else spent in the hospital, vacations canceled. Sweetie, I need to be. And so I just want to thank everybody for their time. Vega, please sit. I just want to thank everybody for their time. Oh my gosh, this is what our life is like. To thank everybody for their time, all of our participants. Thank you for being here with us. If we have any siblings, I hope that you were able to, hear from some Vega. I'm serious. Stop. Any siblings who, from siblings who have gone through what you're going through, and just learned a little bit more about what you need or want. And I think it's okay to be asking for that. We're really thrilled that this was able to come together. Everybody, put important things aside to be with us tonight. And there's a lot of other important stuff going on in their lives. So we'll close here, but I did want to quickly just say thank you again to all of our panelists for sharing your wisdom, your experience, your passion. You're all incredible advocates. And also wanted to, again, thank Zogenix for being so transparent with what they have and what they've done and for being committed to this. It's really an incredible gift for our families. So a quick note that we have a couple of other upcoming webinars on the 12th. We have part one of a 4-part series that we're doing in conjunction with the LGS Foundation on rescue medications for the severe epilepsy. So that's going to be an incredible one with Ellyn Worrell out of Mayo Clinic and Ann Berg, who is an incredible researcher who's done a ton for DEEs. And then on June 17th, we just are confirming that we're going to be having a webinar on the coronavirus vaccine development and treatments that are kind of underway, getting an update on where things stand with that. And that'll be in conjunction with NIH and with a pediatric virologist. So that's going to be a really incredible one, I think, and there'll be time for questions. So we really hope that you'll join us for those and that your families are staying well in the midst of COVID. We're still very much with COVID and with the struggles that our country is going through right now. So please stay safe. There will be I hope, an evaluation that pops up when you close your windows. So please just take 2 minutes and let us know what you thought, if there's anything we can do better. And take care, everybody. We'll see you next time.
Thank you.
Thank you, everyone.